Dr. Indar, tell us exactly what your presentation to the Council of Commissioners and Ministers of Tourism of the Caribbean Tourism Organization was all about today.
Yes, good afternoon. My presentation was on the status of disease trends in the Caribbean and how it impacts on sustainable tourism and what measures can be implemented for improving sustainable tourism, given the increasing trends of communicable diseases that we are seeing in the region.
How important is it to reach an audience of these tourism executives in the region?
Yeah, it is very important. It's crucial, in fact. We're the most tourism dependent in the region. COVID-19 demonstrated what we knew already, that health is important for tourism. COVID-19 devastated our tourism product. We want to ensure a healthier, safer tourism product that we are serving and that we are servicing. To do that, you have to include health and tourism, but it has to be, advocated at the highest level, the ministerial and the policy level, to include health and tourism. Simple things as hand washing to deep cleaning and sanitizing are all important. But our tourism sector needs to see that and to believe in that and to advocate and jointly promote that.
What's the response been like from the tourism community as it relates to your tourism health program?
Well, so it's varied. We have some countries that are doing very well. They're implementing at different levels, and some countries, have not started. So we had varying levels in 13 countries. Some do some things better, like food safety training. I could use Belize and Bahamas. They are pretty good at that. The biggest challenge we have is the reporting by the tourism facilities. They're afraid if they report that this information is going to go out there to the media and that there will be some negative consequence. But the system of reporting that we use, we call it a early warning and response type of reporting. It's confidential. You need a password to get in. We never include someone's name. We don't include the name of the hotel, but it's for us to determine a trend. Something is happening. We want to pick it up, nip it in the bud before it spreads. And the system operates as such. We have had thousands of alerts in the last few years, and you're not seeing that data anywhere. But what we have been doing is that we're responding within 24 hours, so you reduce spread.
This is a rather novel system, and of course it was something that was very important during COVID. Is there a danger, first of all, in terms of us becoming a little too complacent now that COVID is out of the system, as it were?
Well, yes, this is a danger. So before COVID, there was Zika, and there was a lot of interest in putting health and tourism and in reporting and prevention measures. And then Zika went, and the interest went, and it all dwindled down. And we are seeing that right now. Visitors don't want to know about illnesses. The hoteliers are mainly interested in getting arrivals. But take, for instance, if you do have outbreaks and someone goes back and sue you. We have had situations where hotels are sued millions of dollars. One outbreak in a country may result in big lawsuits. We have to prevent that. What about new illnesses? We have had epidemics of pandemic proportions in less than 5 years. We had Zika, chikungunya, and COVID-19. Before this, the last pandemic was over 40 years ago. We didn't have this. And if you want to think about the Spanish flu in 1912, if you think about that. So, and the way how the trend is going with climate change and all of that, it has already been predicted that something else is on the rise. You're going to see some rapid spread of some viral outbreak. So we have to be prepared. Tourism sector, especially for the Caribbean, we are so unique. We are small. All our islands are small. And our borders are close and it's porous. So we can't say, well, my island is protected and the other island is not. We have to implement it in the region. We have to go through the process of tourism seeing, look, if I want my tourism to be sustainable, I have to include health in it.
Finally, is there potential for this particular model, which was birthed in the Caribbean, to be replicated in other regions throughout the world based on its success here?
Absolutely. We have had Latin America countries ask us to translate, to use it. We were funded by the IDB And and through our evaluations, they asked, can we translate this? When we present this at the World Travel Market and so on, people ask us how they can use this in their establishment. The system is all electronic. The system of reporting, the system of response, the training, so it can absolutely be replicated. But the novelty is the fact that we started this in the Caribbean. Nowhere in the world you have this health and tourism partnerships, or you have a hotel reporting or cruise ship reporting, and it works, and it does work in the Caribbean, and we think for the tourism dependent regions it can work as well.